Hey, you guys, I am here with Dr. Nathan Wooten, and I'm just going to get right into a bunch of questions. Can you tell me about back pain relief is specifics?
Well, back pain is excitation of nerves. They're inflamed, and that gives us pain signals to let the body know that something's wrong with the body. Back pain relief deals with those elements of it. We're getting rid of the inflammation. We're taking away the irritants that cause the nerves to be inflamed and realigning the body chiropractically. That means getting the bones of your body and the vertebrae back in line so that they're moving more easily without restrictions. And that lets the muscles relax and function more balanced. And then that creates less inflammation. So
It-
it's a trifecta of approach of getting things in line and letting the body take care of itself.
Gotcha. So, can you talk about like lower back pain versus upper back pain?
Okay, so lower back pain versus upper back pain, the fundamentals are the same. As chiropractically speaking, we believe the vertebrae are out of alignment. That causes muscle imbalance, extra friction of the joints. That creates inflammation that then causes pain. So we usually have a little more tendency to have low back pain because of poor posture, um, lifting wrong, work habits, stuff like that. So it's a little more prevalent, a little harder to remedy sometimes. But upper back pain is usually ribs out of place or some, again, poor posture is a key factor in that as well.
Why is lower back pain more difficult to work on than upper back pain?
To be honest, lower back pain is usually a little more difficult because I think a lot of the population carries a little extra weight around the middle, and that pulls a lot on the lower back issues, as well as we sit. So many of us sit, so the front muscles of our legs and our back kind of they get shorter than they should. So when we stand up, they're too tight, and then they're pulling more on the low back, causing a little hyper flexion of the or hyperextension of the low back. So it's just a product of our work environment, probably more than anything.
So, is there anything that people can do to, even if they're a few pounds overweight, or if they do have more weight in the front, what what is a what's something that people can do? Like if I change my posture from sitting up to slouching, does that make a difference?
So changing your posture from slouching to sitting up helps some. It helps strengthen the low back muscles and helps keep that posture in proper alignment. However, there's muscles of the legs, the psoas muscle that attaches from the inside of the low back spine to the legs. When we're sitting, that muscle is shortened. So when then we stand up, there that tension is there. So things to help beyond just sitting up properly is to get up and move around every half hour to an hour. I would do every half hour. Just get up and stretch your front core, stretch the legs. If sit stand desks are exactly designed for that purpose, so that we're not sitting stagnant all day long. The body likes change,
Got
so if we're in one position more than another, that's usually not a good thing.
what would you consider a chronic pain issue?
Chronic back pain is a it's back pain that just doesn't go away. It's usually can be mild. It can be just irritating, kind of like a splinter. It just doesn't go away, and that again correlates with just a static posture usually, lack of stretching, lack of change of sitting postures. Um, so we really the body just needs change. It needs to sit, it needs to stand, it needs to walk around. So if your job allows it, or your workspace or whatever, if you can get up and walk around every 30 minutes, just take 5 minutes every 30 minutes, you should notice quite a bit of difference or improvement in that.
In today's society of we're all on desk computers and we're all on our devices, probably with our heads hunched down.
Right.
Um, Tell me about just talk about neck pain relief in general.
My favorite analogy for our neck is if our head is a tree and we have guide ropes on north, south, east, and west holding the tree upright. If we lean forward, that tree gains momentum forward. So it pulls on the three ropes in the back, the sides, like let's say east and west, and the south rope. It pulls on those so we feel tightness. So our natural tendency is to stretch even more. That allows the tree to fall further forward. So the best way to upright a tree is not to pull on the back rope, it's to push in the front. So I try to coach people to upright their head, upright their head, set a reminder on their phone every hour to check their posture, make sure their head's up over their shoulders, do some what I call double chins or chicken heads where you're sliding your head back and forth from neutral back. That will help strengthen the posterior muscles, strengthen the south ropes, and upright the tree and hold it better over your shoulders where it should be more balanced. I've read the head weighs 15 pounds and it at 10 degrees forward, it weighs more like 50 pounds. So imagine holding a brick close to you or holding it out front, it's going to really pull you down out in front. That principle can apply to the neck.
What kind of ailments, what kind of problems have you seen with that, and how do you treat those problems?
So the ailments I've seen with poor posture in necks is the neck curve should be shaped like a D. And when we have chronic head forward posture, the curve actually goes from a C shape to a straight curve, or even leans forward a little bit more. Imagine balancing a rock on a stick. If it's tilted forward, it's going to just eventually fall forward. What happens then, we get more pressure on the front of our discs, and that squishes them back. So then we tend to get disc issues where we cause or experience radiation down our arm, numbness, tingly, stuff like that. So um, that's just a chronic issue that we've got today with our computers and our devices and leaning forward.
This is not an issue that can be fixed all at once or just in a couple of, if somebody has been using their device over and over again for days, even months, their head is in that posture. Obviously, this is not something that can be fixed in just a couple of visits. How do you work with that?
Correct. So usually we can get, as far as fixing a chronic neck issue, it does take time. We can get you out of pain chiropractically usually pretty quick. The problem is the structural issue is still there, and it takes time to correct the structure there. Even a soft tissue injury like a sprain or strain can take 6 weeks to fully heal. So this is a chronic, months-long issue that can take months to correct. We do the adjustment to help keep the vertebrae in line and moving properly. Then there's homework for you to do that helps recreate that curve in the neck. And then that usually is a couple months total to get that correction going.
Tell me about sciatica. I don't even know what that term means. All I remember is it's something with the back of your leg or your back.
Sciatica is basically inflammation of the sciatic nerve. So any medical term with on the end of it is usually inflammation or irritation of. So the sciatic nerve is a group of four nerves from our low back that come out and go through the buttocks, and then they branch out to different areas of the leg, kind of like a highway, and you have exit ramps to go to different destinations. So sciatica is a general term that could mean inflammation of any one of those exit ramps, one of those peripheral nerves that goes down the leg. It can go to the groin, it can go to the knee, it can go to the calf, and even to the big toe or toes. And so depending on what level the irritation of the sciatic nerve is in the low back, we can predict how far down the leg, or we can correlate how far down the leg the symptoms are with the level of injury or irritation of that nerve in the low back. if you're on a highway and you have, excuse me, 5 exits, those could represent the nerves of the sciatic nerve, the exits of them. They all branch together at some point to go off to a different destination. So if you have let's say on the highway, an accident at the most southern exit, then that is going to go affect traffic down to the most southern part of your leg. The most northern area of the low back of the highway, if that exit is irritated, that's going to affect the more northern region of your leg. So we can kind of map that out just like a highway and exits.
What's a typical treatment for sciatica?
Typical treatment for sciatica: one, we've got to get irritation off of the nerves. Many times that's a misalignment of the vertebrae. When the vertebrae, they should be all stacked up nice and easy like a Rubik's cube. But if the pieces of the cube get twisted a little bit, that's our vertebrae, and that closes down on the areas where the nerves exit the spine. So first line of attack is to line up those vertebrae, and that opens up those joint spaces where the nerves exit. So that's the first thing, is adjustment. Another issue that can happen is the discs will actually get bulging. We've heard of bulging discs, um, or thinning discs. So another analogy is plates with a sponge between them. The plates are our vertebrae and the sponge is our disc. If it's full of water and hydrated and in a really good position, there's sponginess on the plates, and that's like a shock absorber. If you press too hard on one side of the plate, that can squish the sponge out in one direction. That's a bulging disc. That bulge actually irritates the nerve, causing those referred symptoms down the leg. So if there's a bulging disc, we can do things like decompression traction, and what that is it's traction of the low back, but it's intermittent. So we pull and relax, pull and relax. What that does is levels out. If the plates are tilted and there's bulging this way, if we pull, we can level out the plates, creating more equal pressure on the disc, and then that bulge can be sucked in and return to normal. So that alleviates that irritation of those discs. Over time, as we age, our discs get thinner and less full of water. They get dehydrated. So doing that decompression will actually pump water into the discs, into the sponges, rehydrate them. And if you've seen an old crusty sponge, it's shrunken and crevice and all that. But if you put water on it, it almost restores to look almost normal. So decompression does that to our discs as well.
Besides decompression, what other treatments do you do relating to sciatica?
Other treatments relating to sciatica, um, we can do electrotherapies. We have electric stimulation. That's 4 pads that stick on your back. Everybody's usually heard of a TENS unit, so it's much like that. It's a little bit different frequencies and some science behind it, but that will help increase circulation, increase healing of the soft tissue, can also help decrease the inflammation. So that helps give relief there. I love to coach people in simple, effective exercises or even stretches that you can do at work. So I can coach people just to do 5 minutes of stretching every hour. Um, should really help alleviate a lot of that chronic stuff that's going on in the low back.
I just think it's interesting in general how um, people just tend to sit a certain way, or they have a certain posture that they always use. And the more you do something like that, the more you do harm, the more harm is done.
Right. Yeah. Our body adapts to what position we're in the most. So if we walked around like this for a couple of weeks, we would start to be in that position. It would be hard to stand up. The vertebrae on the concave side would actually shrink in their width, and the vertebrae on the parts on the convex side would actually expand to fill that gap. So our vertebrae would actually become wedged over time. So if we do that leaning forward or slouched, our body's gonna become what it is, the position that it's in. So um, just like walking on your shoes. I don't know if you've ever looked at the bottom of your shoes, but they will mold and scuff based on the way that you walk. And it's a telling thing to look at shoes and look at your posture. And if you took an X-ray, it would inside it would show that we're kind of all bent forward and leaned over to the side.
I know that chiropractic care is helpful in relief for headaches, at least for sure. But headaches come from all different sources. And what do
Sure.
you typically do when somebody comes in with headache or even a migraine?
What we do to treat headaches or migraines, my approach is to first take out the least invasive approach, and that's getting adjustments to the neck. When the vertebrae, again, when they're out of alignment, that pulls on muscles, that irritates nerves, that it can even restrict blood flow. So headaches can be, of course, allergies to foods or our environment. It can be dehydration, uh, things like that, that are aside from chiropractic treatments. But the majority of them that I have seen, 90% of them have been structural in their genesis. So what I'll do is a neck manipulation, a neck adjustment, line up those seven vertebrae and relieve tension on the muscles, relieve tension on the nerves, and restore blood flow to that. So you've got quite a few nerves in the upper neck that come out to the head and come into the brain. So, or that's where the brain comes out. So, um, if you have a, a 6 inch hole that when it's misaligned, it's designed to be 6 inches wide in diameter for a 5 inch structure to go through it. But if things are out of alignment, that hole becomes closer to 5 inches. So then you've got a 5 inch structure trying to go through a 5 inch pipe. And it's going to irritate nerves just by proximity. So if we can open up those spaces, let the nerves work freely, that usually helps. I will coach people then on proper hydration, limiting exposure to allergenic foods. I know we get a lot of gluten issues these days. We get uh, dairy issues. So we'll discuss things like that. Sugar is a huge inflammatory thing, and it's in everything. This high fructose corn syrup is in everything. So we'll usually talk about environmental factors, posture while you're sleeping, exercises to do while you're working, and how to get rid of your cell phone. That's the genesis of all of our issues is the darn cell phone. We're looking forward down at it so much. So we all just need to throw away our cell phones and just talk to people face to face upright.
So what I'm hearing you say is that even though many causes of migraines and headaches are not due to your adjustments, your physical structure, having chiropractic care will definitely help alleviate that stuff, right?
So even though not all headaches and are structurally related, chiropractic can help on the as an alternative, as a ancillary therapy to help, even if it's say allergies that are causing the issue. Chiropractic can help facilitate those things better and move them quicker into healing.
How can chiropractic care help with posture improvement? Every to get healthy, to be healthy,
Sure.
we want to work on our posture. So how does
Right.
chiropractic care help with that?
So chiropractic care to help with good posture. We help in a lot of different ways. Another analogy or another just a aha moment. If you put your glasses on or your clothes on or your watch, you're aware of it at first, but over time, your body shuts off the input of that stimulus just because it knows your watch is on. It doesn't need to really be aware of it. Same thing happens with our posture. We will have bad posture and it hurts, but then the body normalizes to that. The body says, all right, this is where we are. We're going to just accept that and be done with it. So then the body doesn't know where neutral is, where good posture is. chiropractic helps the body remember where good posture is. I have people that say they don't realize that they're walking kind of lopsided until they get an adjustment. Then they feel more balanced. They feel more level on both feet. So chiropractic stimulating the nerves will help the body be more aware of itself, of where it isn't and where it should be. You know, excuse me, another analogy that I have is a Jenga game. Everybody's played Jenga with the blocks. The more you move the blocks, the more unstable that gets. So if the blocks on up top start leaning forward, then that's going to make the whole body, our structure, more inclined to fall more forward and just come out of alignment more. But chiropractors are the master Jenga players, and we can shore up and square up all of those little blocks. That's our vertebrae and our bones. We can gently pack them nice and tight and neatly. Then that gives the body better structure, better stability, and then the body's like, oh yeah, this feels good. That didn't feel good, and I want to stay in a more neutral position. Um, I have a saying that we don't know how bad we feel until we feel good. So you may feel a little run down, but you may not know why. Well, your body's working harder to keep your posture upright. So if you can keep your body in a more balanced, neutral position, it works easier. Then you're not so worn out during the end of the day or by the end of the day.
I know a lot of people, especially young adults. Well, actually, even older adults. I've injured myself in sports, but what are some of the main sports injuries that you see? How would you treat those injuries from a chiropractic standpoint?
So the main sports injuries that I see are sprains and strains. That's muscle pulls, tendon pulls, ligament injuries. Um, in the effort to be a good sport, a good athlete, we push ourselves continually to get more and more stronger, more better, more all this stuff. So as that happens, we're going to sustain injuries, or we get just things happen. So those ligaments, muscles, they get stretched a little more than they should be, or torn a little bit more than they should be. Um, what that happens in our chiropractic approach is that allows then the bones to shift more than they should out of place. So analogies, I love analogies. So if you have a truck loaded full of stuff and then you strap it down with ratchet straps, the ratchet straps are our ligaments and muscles and tendons holding everything together. If you suddenly stop or turn too hard, the stuff underneath the straps shifts, and then that will create slack in the straps. So then you have to tighten the straps again or reposition the material under the straps. That's basically a ligament injury. The straps are looser than they should be, and that allows the body to move more than it should. So chiropractically, what we do for sports injuries, the alignment is for sure. The adjustment is definitely needed because we need to keep the bones in proper alignment so that the ligaments can tighten up, naturally heal on their own and tighten up in the proper alignment. Imagine if you had vertebrae like this and ligaments on all sides, and if they shifted and then just stayed there, then the ligaments would tighten up in the wrong alignment, the wrong position. But if we keep them in line, then the ligaments will tighten up in the proper alignment. You'll have better stability in the long run. Um, so that's the first line of approach. And then definitely we got to keep the muscles loose because they will spasm to try to take up the extra slack. So we've got like say a bit of muscle and then ligaments on each side. If the ligaments are stretched, then the muscle's going to have to contract to take up that extra slack in the space. If we can keep them relaxed, then the ligaments will be in a more natural length and they can heal as they should.
What about follow-up treatment or follow-up care or education with respect to sports injuries?
So follow-up care and education with sports injuries. Once we've gotten out of basically the acute phase, the first several weeks after an adjustment or after an injury, we've got the muscles relaxed, we've got the ligaments starting to heal. It takes time because the ligament, think of it as a braided rope. It does heal, but it takes time because it doesn't have a whole lot of blood supply to the ligaments like muscle or skin. So it just takes time. So imagine a frayed rope and the fibers are reconnecting. At first, they're more like wet paper towels. So what happens is we normally go and work out too early. Those fibers haven't gotten had time to really strengthen and solidify. So we need to give it time. That's why we splint stuff. That's why we brace stuff to let those ligaments just have their time to form the wet paper towels and then to solidify into a stronger rope. So once that part is done after the first few weeks, then we want to start slowly and very intentionally being specific about range of motion with workouts. We want to do very slow, controlled motions. We want to do a lot of stretching, of course, to keep things loose. And we want to be really focused on proper range of motion and low weight. So we want a little bit of resistance so the ligaments are stressed so that they can get stronger and stronger and stronger. Um, but we need to temper that a little bit with some time. And usually I have a 50-50 rule after a workout injury. When you go back to work out, you do 50% of what you were doing at 50% intensity. So if you were lifting 100 pounds 100 times, you'll do 50 pounds 50 times. Then do that for a week or two, then slowly start stair stepping your way back up to where you were.
Okay, so I've got a couple questions with respect to, I guess, overall wellness and preventative care. How can I prevent injuries in general? You know, especially people who are older, they're more susceptible to
Sure,
get injured, right?
sure.
So, can you talk about that a little bit?
Preventing injuries in elderly or even the younger population. Uh, we we use the alignment with the dental field quite often. So dentists always say, come in twice a year, get your teeth clean, get them checked. It's easier to prevent a cavity than it is to fix a cavity. We use that saying a lot in chiropractic. So again, over time, that let's say the Jenga game or the tree that's falling over, whatever it is, if it's just a little bit out of place, we can correct that a lot easier, a lot quicker, because the body hasn't adapted to an extreme shift in alignment. So it's a lot easier to just do minor little tweaks here and there. Same with alignment on your car. We talk about that too. If you let the alignment off go for a long time, then the tires wear out, the brakes wear out, the U joints, whatever, all that structure underneath holding the tire together, that wears out, and it's much more expensive and time involved to fix that stuff. So if we can do little corrections here and there along the way, that's the best way to go. So chiropractors usually are very focused on a wellness lifestyle, a healthy lifestyle. So if we can do a little bit of activity throughout the day, that's good. If we can do a little bit of stretching throughout the day, that's good. If we can eat a little bit better a little bit of the time, then we're usually on our way. I read something that says a lot of 1% changes equals 100%. So if we do a 1% change every day, 1% change improvement, then it doesn't really take long to get to a 100% improvement. So um, with the elderly population, especially, they become more stagnant. They're not as active as they used to be. So that creates the ligaments and muscles lose their plasticity. They lose their flexibility. So if they can do continue movement frequently, and I prefer 5 minutes of movement 10 times a day versus an hour of movement at the end of the day. The body, if it stays loose and warm, then it's much better for the body. So if every hour, I had a lady said that between her watching her shows, she gets up and does a little exercise. So between Maury Povich and Jenny, she can get up and do a little bit of work. So um, keeping that stuff fluid and keeping that stuff mobile over time is much easier than all of a sudden after 10 years of sitting dormant, you're trying to correct and regain that that past 10 years. It's much more difficult to do. With kids, with the younger generation, I know it's a big gaming society these days, and they sit like this for hours, and then they try and go wrestle with their brother or ride their bike, and it's just they need to do variety on a more frequent interchange. So for preventive or wellness care, regular chiropractic visits, even once a month, something like that, if we can do little adjustments along the way, chiropractic care, that will go a long way in helping prevent future illnesses and injuries and create a better wellness for the body.
Perfect. Let's talk about joint mobility.
So joint mobility in general. Um, Joints are lubricated with fluids, and so let's think of an oil in your car or oil in your lawnmower. Every spring we go through this. The lawnmower's sat for months, and then it needs a tune-up. It needs oil change, or it needs lubrication added to its joints. So we're the same. It's the same idea. So if we sit all day, then our knees and hips and our ankles will have issues because we're not getting fluid moving through those joints. Um, so what happens if we're in a stagnant position? Then the knee joint, which is designed to be flexing and moving all over the place, gets kind of gelled up, I guess, frozen up in a certain position. I know for plantar fasciitis, I've had a lot of success with this. We sit all day and then we stand up and go walk. That's the worst thing to do on a ligament structure that's been cold without a lot of circulation in our feet. So if we can warm up our feet and just sitting, just do foot pumps or heel raises or wiggle our toes, that will keep the ligaments uh, slick. It'll keep them slick so that when we stand up and put weight and force on them, they're not getting injuries. And that's what plantar fasciitis is an injury of the soft tissue of the foot. So joint mobility, I mean, the biggest phrase is movement is life. So if we keep moving, we're going to keep having life. And um, that's really just the name of the game, I guess, is to throughout the day keep the joints moving. That keeps the fluid pumping, keeps circulation going, and just helps them work better overall so they don't freeze up.
There are a lot of people out there who are looking for a holistic approach to health. Um, Anything from CBD to essential oils to vitamins. Talk about chiropractic care with respect to being part of a holistic approach to healthcare.
Chiropractic care in relation to being part of your holistic approach to healthcare is really, it's such a huge way of life, and is the way we used to be back in the old days before modern medicine and modern intervention with medicines, prescriptions, pain meds, stuff like that. They're good in a certain aspect, but over time, we see all the time the list of uh, side effects is worse than the disease itself sometimes that the medication is treating. So chiropractic, it began with the idea that the body naturally has a way of healing itself. That's holistic. How can we naturally heal our body or take care of it? So just like I've used the analogy, we cut our finger and we don't have to tell it to heal. We don't have to put stuff on it to heal. It will heal on its own if we just kind of leave it alone for a while. We have cancer in our bodies every day. The body, the function, the processing and digesting of food creates cancer pieces, but they get flushed out through our system every day. So um, the body has that natural, we call it an innate ability to heal itself. If our nerves are working properly, if our circulatory system is working properly. So the nerves run all of our organs in our body. Our nerves run our heart, our nerves run our feet, our nerves run our digestive system. if there's irritation in our spine of those nerves, then those systems are going to not run smoothly or properly. So high blood pressure can be a symptom of the nerves not working right between the brain and the heart. An adjustment can clear out that interruption and help the brain and the body communicate better, and help lower blood pressure. That's how I got into chiropractic. My blood pressure was lowered by a chiropractic adjustment in one visit. So I said, okay, there's a connection to this stuff. So I'm going to go into that field. So um, medicines are good. I'm not knocking medicines, but there are so many things in the everyday life that can be helped, symptoms reduced, or even pain decreased by chiropractic adjustments. And that's the holistic, the natural way of getting things taken care of. We facilitate that process without medication, without surgery, without all these invasive things that could actually damage the body worse.
I know somebody who um, they just had a MRI that told them that they may have to have uh, some vertebrae in their neck fused together. Uh,
Okay.
how, if I'm searching for something, how would chiropractic care, um, uh, maybe not, how would, what would you do with chiropractic care in that instance or in general versus invasive things like surgery?
So chiropractic care versus other interventions like surgery, other invasive things like surgery or injections. Um, Again, we believe and we know the body has the ability to heal itself. So if we had somebody with an MRI that had disc bulges, um, the surgical community they just figure it's a loose joint, so we're going to bolt it together, and that's what surgery is. They'll go in and either trim away some of the bulging disc, kind of like if you had a callus, they would trim that away. That's not necessarily a bad idea, but it's taking away something that should naturally be there. That structure of the disc. Fusing the neck is usually we have a joke in the chiropractic field of when was your first back surgery, because then you're going to have a second and a third usually. And what we
Mm.
see is if you've got five joints that are all supposed to move, then they're all using 20% of the range of motion for that segment. 20% times five is 100%. So low back is five vertebrae. Five divided into 100 is 20. So each joint is moving 20%. If you suddenly take out 20% of movement by fusing it, the surgeons will take two bones and just fuse them together with bolts and screws. Well, suddenly that's not moving, so the joint above and below are having to take over a little extra movement to create that full range of motion. So they're doing 30% each, or one's doing 40 and one's doing 5. Extra movement that's not supposed to be there is going to cause more issues and extra wear and tear. So chiropractic, doing the alignment, doing the adjustment, doing things like decompression, stretches, other exercises like rehab physical therapy exercises like McKinsey exercises, those will help naturally let the body reduce those bulges and actually heal the discs without surgery. And anytime you can keep your own stuff in you is usually a better idea, um, rather than just fusing something that shouldn't be there or that should be moving and blocking it together. We've all probably had a cast on our wrist, and if you immobilize that, um, for a month, you take the cast off and your wrist is half the size that it used to be and it's not moving like it should, then you're going to have issues for a while after that. So it's the same idea with fusing a vertebrae in your back. It can be good if there's some other, if it's a traumatic thing, then yeah, we need to fuse it. But many, many times there are other alternatives that um, allow us to help intervene in a way to let the body take care of itself.
Let's shift over and talk about chiropractic care either in addition to or versus other types of therapies like physical therapy, massage therapy, and even in traditional medical treatments?
So chiropractic care versus other alternative therapies like physical therapy, massage, um, those are all good ancillary treatments. And in the 90s, chiropractic and PT didn't get along very well. We didn't play nice. But since then, there's been quite a bit of amends being made and friendships. I refer to physical therapists. They refer to me back and forth. And there's even some chiropractors that do only soft tissue work, like a massage on steroids. They're Airosty. They do some pretty cool stuff. So, but they're chiropractors, but they don't do the adjustments that we traditionally do. So another analogy I have is if you have a splinter, you can wrap it, you can put gauze on it, you can put ointments, you can take pain meds. Those are all physical therapies and massages. Those types of treatments will help reduce the symptoms of the splinter. The problem is the splinter may still be there. Naturally, the body will work it out usually, but with chiropractic, what we do is we take the splinter out really quick, and then physical therapy and massage can be ancillary treatments to help then promote healing even quicker. So, for instance, if you have neck issues, if you have vertebrae out of alignment, let me back up. So, a neck injury or neck pain is all three things: it's bone, muscle, and nerve. It's always all three. I hear all the time it's just a muscle thing. Well, muscles attached to bones, and nerves tell the muscles to move. So chiropractically, it's all three things. We call it the vertebral subluxation complex. That's a fun trivia word. But if we can get the vertebrae back in line, then that immediately relieves tension on the nerves and the muscles. Physical therapists are muscle guys. They are fantastic at balancing muscles. So if you need help with some posture training or whatever, they can help with that. They can help balance unbalanced muscles. They can help rehab injured muscles, but they're not putting the bones back in place. They're not removing the thorn. So massage is the same way. They're not allowed to move a bone. That happens occasionally by accident if they push enough, a rib will go back in place, but that's not their focus. Their focus is relaxing muscles and helping increase circulation to promote healing. So I've had people come to me right after a massage because then they'll move better because massage is helping the muscles relax. I've had people go to massage after an adjustment because then it helps balance those muscles easier and relieve the inflammation that was released by the adjustment.
When should you get a massage, before or after? And I guess the answer is depends on what issue you have, right?
Right. If massage before or after an adjustment, uh, if there are occasionally people that are so tense that it's hard to get something to move chiropractically, it's hard to get the adjustment. So I've had some people I've asked to get a massage beforehand, and that does help the adjustment go smoother. Um, I've had one guy that would do one before and after. He'd get a massage before and after. That's a lot of money. That's a lot of time. But I mean, that's a slam dunk in getting things fixed. Is get relaxed, get the adjustment, and then get it all smoothed out afterwards. So it varies case to case for sure.
All right. Well, hey, thanks, Dr. Wooten. Appreciate the time, and
Yeah.
we will talk to you later.
Thanks very much, Tim.